Believe it or not, we're already at learning unit number 5. This is our last full learning unit. So as you can see, just right now, you can see that we do have learning unit number 6. That is a final couple of days. It's actually from June 24th through June 28th. It's a final couple days to finish a one-page final course reflection and also to assure that all of your clinical practicum modules are completed. But be that what it may, let's go back to Learning Unit 5. And we have 3 different topics, and we're going to look at what they all have in common as we're talking about patient safety. And that's human factors engineering, patient engagement, and new nurse residency programs. So when we click on, you're going to see the first document here is, of course, our topic description and our end of learning unit outcomes and what the learning activities are for the week. So as I said, we're looking at 3 healthcare-related safety strategies that have a significant impact on patient safety in nursing care. And those, again, are human factors engineering, and that can be defined and was defined by our authors as the applied science of system design, which is concerned with the interplay of humans, machines, and the work environment. And then we're also looking at family engagement and patient engagement and the TTP, so the transition to practice programs for new nurses. We're going to end this learning unit number 5, by submitting your PICO question and literature review assignment that we spoke about in last learning unit. So we're going to have a couple of assignments, of course. So let's close out of here and let's look at them individually. You're watching this video right now. The readings are, I believe in the syllabus, I might have had one additional chapter, but you're going to be reading Chapter 7, Human Factors, and I just made a mistake here. It's Chapter 21. I will correct that for you, so when you're looking at it, it will say Chapter 21, The Role of Patients. So this is in our ebook that we have been using this semester, so, and this mini. So Chapter 7, Human Factors, and Chapter 21, The Role of Patients. I have removed Chapter 9 from the readings, so that is not included. So we're going to look at just 2 things when we look at patient and family engagement. We're going back and finishing up the last couple of pages, 16 to 19, in the Zero Harm in Healthcare document. So this is the 3rd time we're reading additional pages in Zero Harm. There is a 1-page document. It's an opinion piece by a physician about the importance of and the difference in patient outcomes when families are in the room. And so then next is the human factors. And here is a picture, an infographic that comes from the National Center for Human Factors in Healthcare. And I want you to just, it takes 1 second to click on this image and just review that along with your readings from Chapter 7. This is a really nice infographic to look at. And then a short document further defining and seeing the application of human factors engineering. So next we look at the folder of retaining nurses. And all of this I've tried to abbreviate the work this week as last week. So retaining nurses, you're going to go to the, well, let's click on. You're going to look at the AACN Vizient nurse residency programs. Most hospitals started using this AACN, this Vizient nurse residency programs, and some of the larger healthcare systems have since changed and transitioned to their own. But you can read information about this nurse residency programs, and as many of you know, how they do go about retaining new or novice nurses, the benefits of nurse residency programs. I just heard of one healthcare system locally that has decreased the length of nurse residency programs, and I was saddened to hear about that. And then there's a document about retaining older nurses. So I think you'll find that kind of helpful as well. So we're looking at the new that we're bringing in and the older nurses. How do we recruit, retain our nurses? And the discussion board post for the week is allowing you to pick one of those three factors. So human factors engineering, patient and family engagement, or transition to practice programs. So pick one of those and then share how this specific safety strategy applies to your initiative for this course. Sometimes you have to kind of reach to make it really fit. But if you find that none of those three factors really applies to your program or your initiative, I will be surprised which one closest applies to your initiative. So give some information from our text and a source cited in your literature review. So it's important that we speak, that we share a little bit about our patient safety initiative with our classmates. Being so quick, it's hard to share the full outcome of all of your hard work this mini, but it's good to share a little bit about your patient safety or the well-being of nurse initiative that you have been working on. And finally, this is your literature review Dropbox. So as we went over in learning unit number 4, we looked at the grading rubric, what was the expectation of developing a PICO question and doing the literature review. This is the place for you to upload your final document. If you need to look at that information again, you can look in learning unit number 4, or you can look at the Start Here folder. So that is it for learning unit number 5. When this closes, which is on the 23rd, actually a couple days before the 23rd, the learning unit, let's get back to it, the learning unit number 6 will be opening. And that's the final course reflection. So I just wanted to make sure that you saw this is just a poem about experiencing rest, a 1.5 minute video by, I think, a lot of our favorites, Dr. Donald Berwick, about patient safety. I think it is a 1.5 minutes. But what you're going to want to know is your final course reflection assignment. The assignment is actually, we have 6 learning outcomes for this course. Not using the 6th, using one of the first 5 learning outcomes, any one of the first 5 outcomes. Use examples from your class, your assignments, or your clinical practicum experiences, those modules, and write a really brief 1 or 2 page max Word document that shows how you have met this outcome. So maybe you're looking at outcome number 4. examine the interaction between nursing workforce issues and patient outcomes and safety. How did you meet that learning outcome? So pick 1 through 5. It should be really brief, 1-2 page max, as I said. Make sure your name is on it, but you don't need a title page. You don't need to have any APA. This is a time for you to reflect. And one of the ways to do that is to kind of go through, look at your discussion boards, look at some of the readings again, as far as what were the learning activities in our 5 learning units that helped you, and our practicum modules that helped you meet these, just one of these 5 learning outcomes. So that is going to show, I believe I have it set up for maybe the Thursday that, so that would be, I think that would be like the 20th or 21st, it should be showing. This time also gives you, the Learning Unit 6 gives you a time to complete all other assignments as well. Please know that our course comes to an end June 28th. June 28th is not a Sunday night. It is a Friday evening. So it is a shortened time frame. So we're going to need to have everything in by June 28th. So any difficulty in doing that, please do contact me. We can work together to make it happen. But otherwise, this will be due, and all your practicum modules will be due by June 28th. So have a good week. Contact me. Let me know what's going on. If you need to run any ideas by me to finish up your learning unit number 5 and your practicum modules. It's been a pleasure to have you in this class, and I look forward to our future courses together.